Hi, my name's Jeannie Carey. I'm from the Louise Harrington School of Nursing at Baylor University, and I'm here today to introduce you to our homegrown solution, the simulated IV bypass system. We came up with this apparatus in response to a problem that we were having that I'm guessing maybe some of you are having as well. We needed to have additional sites for our students to practice IV skills, IV infusions, IV push medications, on our low fidelity mannequins that did not have IV access or IV capabilities. The simulated IV bypass system uses just a few parts, and most of them you already have in your labs. The one part you probably don't have and is necessary for the construction of the apparatus is this female to female lure connector. You're also going to need an IV extension set, some type of drainage tubing that allows backflow of fluids. We use IV secondary tubing, a bag for collection of the fluids, so we just use an empty 1 liter IV bag, your occlusive IV site dressing, and then you may want some type of compression bandage to use to secure the drainage tubing to the mannequin's arm, as well as obscure it from the student's vision. Assembly of the simulated IV bypass system is quick and easy. You just take your IV extension set and connect it to one side of the adapter. It doesn't matter which one. Come over to your IV tubing, which is open. Connect it to the other side. Take the IV tubing and spike the IV collection bag, and you're really ready to go to the bedside at this point. Here you see the simulated IV bypass system placed on a mannequin. You choose a site that is appropriate for IV insertion and secure the apparatus with your Tegaderm dressing. You may want to use additional tape to secure the IV, similar to what you would do with a real patient. The drainage tubing then just goes up the patient arm and we feed it through the patient gown here, and then obviously to the collection bag, which can be hidden underneath the patient's pillow. The system is now ready for use. Students can attach IV fluids or administer IV medications depending on your objectives. One possible enhancement of the simulated IV bypass system would be to use this compression dressing or an ACE wrap to conceal the drainage tubing and secure it to the mannequin's arm. You could also consider using a compression sleeve that is in the same color as the mannequin skin tone. Another potential use for the simulated IV bypass system is with high fidelity or advanced mannequins. And although these mannequins do have IV capabilities, depending upon your objective, you may want to bypass the mannequin's vasculature system in order to save time and also wear and tear on your mannequin. By using the simulated IV bypass system, you save on punctures to the mannequin's skin, potential damage and real damage to the vasculature system, and the various backflow regulators that are part of the mannequin's internal system. Most manufacturers of the high fidelity or advanced simulators recommend administration of distilled water only. So the simulated IV bypass system allows you to administer any number of fluids, anything from blood products to TPN to normal IV fluids. Another idea we're pursuing as far as use of the simulated IV bypass system is with standardized patients. You can see here how easy it is to go ahead and apply the simulated IV bypass system to a live actor, and thereby creating the ability for students to go ahead and administer fluids and or medications via the simulated IV bypass system with its drainage bag.